have the greatest number of confirmed coronavirus cases on Earth.
News that the US now tops the world for the most COVID cases was the confirmation most Americans had been dreading. Despite millions of people in lockdown, an escalation of the lethal virus beyond their control. But for one American, President Trump, it seemed not to register.
A lot of good things are happening. The mortality rate is, in my opinion, way, way down. And that takes a lot of fear out. You know, it's one thing to have it, it's another thing to die.
At Elmhurst Hospital in New York, where a refrigerated morgue is parked out back to collect the dead, they probably don't see it the same way as President Trump. It has 545 beds, and every single one of them is used by a COVID patient. Non-virus patients are being turned away. A chaotic mass lines the street waiting to be tested, while ambulances rush the sick inside to staff who say they don't have enough protective equipment to cope.
They're overrun with patients. We need federal help. We need emergency supplies for those masks and other personal protective gear.
The numbers are stark. In New York City, the epicenter of the crisis, the number of COVID patients in intensive care leapt 45% yesterday. They have just 4,000 ventilators and are telling President Trump on a daily basis they need 30,000.
You know, 30,000 of them, 30,000.
The president says he's doing all he can, but listen to his response yesterday on a Fox News talk show.
But I have a feeling that a lot of the numbers that are being said in some areas are just bigger than they're going to be. I don't believe you need 40,000 or 30,000 ventilators.
Contrast his tone with the governor of New York, who's become a national hero with his straight-talking daily updates. His response to President Trump's jibe?
Well, maybe you don't need 30,000. Well, look, I don't have a crystal ball. Everybody's entitled to their own opinion. But I don't operate here on opinion. I operate on facts and on data and on numbers and on projections.
They're already building 4 extra hospitals to help cope with the expected influx of patients, including this massive conference center in New York City, now a giant intensive care ward. But the governor says they urgently need 4 more, and existing hospitals have to double their capacity using every inch of available space. As they scramble, so President Trump does too. He says he's on top of the crisis, but if he was, would he need to publicly berate car makers on Twitter today? General Motors must immediately open their stupidly abandoned plant in Ohio and start making ventilators now. The irony is General Motors and its partner had reportedly agreed to make thousands of ventilators, but an announcement was pulled this week because of a row with the government over price. It's not just New York in need, though. The US Navy ship Mercy is on its way to another hotspot, Los Angeles in California, where cases there are climbing at an alarming rate. So too in New Orleans, Michigan and Chicago. The virus taking hold across America, and a president who at the end of February reassured the nation it's going to disappear, just like a miracle. Well, the news here is really becoming more alarming, more stark on a daily basis. Just look at the numbers. Only a week ago, there were 9,000 cases here, about 149 deaths. Today, as you said earlier, that number has jumped to 94,000 infections and over 1,400 deaths. Now, those numbers are scary enough, but remember, because of the lack of testing, the poor amount of testing across the country, that those numbers probably are not really representative of the true scale of this crisis. That's the big fear. And it's worth dwelling on New York because many people are worried that cities like LA and New Orleans, Chicago, I mentioned in the piece here, there are simply following in New York's footsteps. The governor there, Andrew Cuomo, you saw in my piece, warning today that they need across the state 40,000 intensive care beds, and yet they have 3,000.
100,000. Those are stark numbers and really underline the extent of this crisis. And yet you have a president who says next week he will press ahead with his plan to outline new guidelines for social distancing in his desperate bid to get Americans back to work. Now, Americans, of course, want to go back to work. No one wants to sit around at home doing nothing and earning no money. But the worry is if he acts too soon, and everyone thinks that next week, those guidelines, it will all be too soon, that if he does that, then he will make the situation worse, that the virus will spread, and that the economy, therefore, will be hit even harder, and that the economy will take longer as a result to recover.